Good morning. This is Mayor Turner. I wanted just to give you a daily update. As of 11:59 last night, the limited shelter in place has gone into force. Let me explain a little bit about the limited shelter in place. The goal of this is to keep you safe. The goal is to make sure you're staying home as much as possible, unless you are one of these critical services that have to be at work, firemen, policemen, things like that. So, what this does is it will close some businesses. Unfortunately, that is something that we have to do. But I've been getting a lot of questions. People have been asking, and I've got 19 questions here. If you have a question, please write it. The city staff will take it off of this video, send it to me, and then I will answer those questions. So I'm just going to start with the first one. It says, what are we doing to monitor man camps? Many of them are from Louisiana, the hot spot. They drive in and out every 7 days. The health department is monitoring the man camps. The man camps are also doing a good job of sterilization, making sure people stay further apart. And so those are actually in the county. So the county is doing a very good job of taking care of those. Judge Hayes has been very proactive to make sure that things like that are taken care of. Excuse me. Next, is there going to be a curfew? At this point, there is no curfew. We do have a curfew for teenagers. That's been around. It's going to stay around. That's just to keep them out of trouble. Another one says, has the problem with reporting the numbers been corrected? Are the private companies now reporting to the health department? The answer is yes. The health department is doing a great job of communicating with these private companies. And so those are reflected in our numbers. I think they're having trouble getting hold of one of them, but that is in the process of being taken care of. Next question, will dealerships be able to remain open and sell to the public? The answer is yes. They are a critical structure or critical company because they sell parts for our cars. And the federal government has dictated that they are part of the critical businesses. And also, I was going to tell you, on my Facebook page, I have posted this document. This is what we call the CISA. This is from the U.S. Department of Homeland Security. A lot of the essential workers are listed in here. This is a great document. I don't know how to do Facebook that well, but I took pictures of it and put it up. So it is on my Facebook. You're welcome to look at that. If you still have a question, email me, contact me through Facebook, whatever's easiest for you. Let's see, game rooms, number 5. How are they staying open and allowing more than 10 people in at any time? With this new declaration, with the county and we have issued the same declaration, which is great. Judge Hayes has been fantastic to work with. Game rooms are closed. They are just closed, period, because it is too easy for people to get too close inside the game rooms and get sick. Number 6, why hasn't the mall been closed? I spoke personally yesterday with Mr. Bushman. The mall will be closing as of today. There are some businesses that can stay open, and so they are working on ways to be able to access those businesses. Businesses such as GNC, because that helps with nutrition. Also, there is an optometrist in the mall that he is allowed to stay open. Of course, Fuddruckers will be allowed to stay open. I believe the home store has opened because they have household items. So the mall is closed to the public except if you need to go into those businesses. The next one says the people who stand in the line at the grocery stores are not standing 6 feet apart. And why not? The last 2 days we have been working with the grocery stores. to limit the number of people that can go in there. We want everyone to be able to access food, but if you have 500 people inside, say HEB, you can't stay 6 feet apart. The grocery stores are being very good about making sure to work with us on limiting the number of people in there. We are working on those numbers today. We are also asking for them to clean the carts. There's one grocery store right down here in the old Dunlap's building. They're actually spraying your hands with sanitizer when you walk in. They are wiping down all of the carts and are doing a fantastic job. So that is in the process of being done. This question brings up a great point. The most dangerous places in Odessa are when you are in line. I went into Harbor Freight the other day. They're doing a fantastic job of separating. You stand in this little box, and when the next person moves, you move into the next little box. Lowe's has done a great job of doing the same thing, making sure you're standing 6 feet away from somebody. So I commend those stores that are working so diligently to keep our public safe. The next one, will the city do daily, weekly press conferences on local media? Not everyone has Facebook. We realize that we are going to be working with the 2 hospitals. We will be doing press conferences at 3 o'clock every day for the next week. And then we're going to continue the press conferences because it's a great way to get information out. So we will continue to do that. Hopefully this thing will end fairly quickly and we won't have to worry about it much longer. Where do people get work permits for their cars, and what is the wording? We are not requiring work permits. The police department is asking if you get pulled over where you're going, because we do want to make sure that we're checking to make sure people are abiding by this law, this declaration. So let's see. Why are people who have most of the symptoms being denied testing? Basically because they answer they have not been out of the country, but they have all the other symptoms. I posted a video this morning from the council meeting yesterday. A lot of that, the testing requirements have to do with the CDC. The CDC puts out the requirements of what they want done before testing. There is a doctor. We brought up doctors from Medical Center. We also brought up some from ORMC. The doctor from ORMC did a fantastic job of explaining this. So I have posted that video on my webpage, or on my Facebook page. If you will watch that, it will explain everything. Explains about the numbers, explained why our numbers may be a little lower than somebody else's, but it's a great source and he covers it step by step. Because the CDC started out requiring that the person that got a test be out of the country or have traveled to an area that was maybe, Italy or some of those other countries that were really getting hit hard at that time. But the CDC guidelines are changing every day. And so that he gives a great explanation, and I would recommend you watch that. He can describe it a lot better than I am. I'm not a doctor. I know of the CDC, but I don't know exactly how they work, and so he can explain that better. Let's see. With the shelter in place, does a caregiver going to check on her dad need a permit to be out to do that? No. All of the people checking on others, you're not needing to get a work permit or anything like that to do that. You can just go take care of that. Let's see. More details on a place to get simple details on what is and what is not allowed with the shelter in place. A lot of avenues are open. You can call City Hall if that's how you feel comfortable. They can get messages to me. I'm taking them through email. The attorneys at the city are taking them through email. We've opened up emails, phone calls, of course, through the web pages. We are doing everything we can to get that information out, realizing that not everybody maybe some of our older citizens don't understand how to work the phones the way the younger people do. So we're keeping that open to make sure you can have access to any question you need to ask. I've probably got 50 that I'm going to answer this morning. And so it's our pleasure to do that. And we want to make sure everybody understands. Next one says, if an employer requires you to work, but will not give you an essential employee form, what should you do? Like I said, there's no need for an essential employee form. If you are covered by the document that I put on my Facebook page, which answers a lot of those questions, just go to work. You're ready. You're all taken care of. Next, it says Exeter County law enforcement is not being given the information that city is being given, and therefore do not know the answers to questions citizens may ask. Now that we've taken the declaration together, all that information applies to Exeter County and Odessa. So the information to be able to give out from the sheriff's department, the county employees, the city employees, is all going to be the same information. So that has been taken care of. Number 17, must county residents also abide by the city order? This is needed to be stated very plain. Does a city shelter in place apply to the city and the county? After yesterday, yes, it is. So we need to make sure that the county is abiding by the same rules as the city. It makes it a lot easier. I commend Judge Hayes adopting the same thing as the city. It just makes it simpler for everybody. And so if you hear it from me, you're going to hear the same thing from Judge Hayes, and which is fantastic, and we can make it effective. 18, you've been exposed to someone who has it. What should you do? Plain and simple, to quarantine yourself. Don't think, well, I won't get it. You need to go quarantine yourself. You need to stay in for 14 days. I understand it's a little scary. The things you need to look for, which the doctor said yesterday, and if you watch that video from the council meeting, it will be in there. You're looking for fever of over 100, and you're looking at shortness of breath. Coronavirus, from what they've told me, attacks the lungs. And if you have things, like we said before, high blood pressure, you're a cancer patient, if you have immune problems like AIDS or anything like that, if you're like me, I have bad lungs, I have to watch out for it. If you're over 65, you're in that class that it's even a little bit more concerning. And that's why self-quarantining is basically one of the things we're going to start to say is stay home, be safe. You're safer in your home than if you're out in the community. If you're in the community, not everybody in the community has it, but the best thing for you to do is pretend they do. So if somebody's getting too close, you back up and keep 6 foot away from everyone. That's what will make the difference. Number 19, has the council thought about being proactive by preparing to find, they hand wrote it and I'm having trouble. Basically, they want to know if the hospitals and the city and the county have looked into extra beds, maybe in the Coliseum, things like that. In that video from council yesterday, the doctors explain their plans. They have plans for plans right now. And one of the things they are relying on us as citizens is to flatten the curve. I'll go over that real quick. In math class in high school, we all had a thing called the bell curve. It was that curve that went like this. Nobody paid attention. I know I didn't. But what they're talking about with flattening the curve is simply, we do not want coronavirus to go up like this real quick, because that's when it overruns the hospitals. You hear of equipment shortages on the news all the time. We don't want that to happen. We know coronavirus is in Odessa, and we know it's going to affect us, but we want it to be a slow curve. We don't want hundreds of people sick at once. If we keep it manageable, the hospitals have no problem with amount of beds, equipment, and things like that. One thing that the doctor said yesterday, which is fantastic, is just because you're feeling bad doesn't mean you have to run to the hospital and get tested. If you are feeling bad, he said, manage it with cough syrup, with Tylenol or Advil for the fever. And as long as your symptoms aren't getting really bad, stay at home and get to feeling better. Because he said only about 20% are the cases where they need to go to the hospital. That's for people with bad lungs or if your fever goes up and things like that. He does a great job explaining that, and I encourage you to watch that council video. It'll take probably 10 minutes. So that's a great information. Talk a little bit, had some questions that have come up, and I just thought I'd get these out of the way. Mobile car washes are okay because they deal with cars and they are not in constant contact with people. Let me just talk a little bit from my heart to the citizens of Odessa. You know, I'm born and raised here. I've watched the ups and downs of the oil fields. And one thing I've always admired about West Texans is their determination. Things can go bad, and they would get a little scared, but they were more determined. And nowhere did I seen it more than August 31st. People were scared, but they were more determined that we were going to get through this. We were going to take care of the people that needed to be taken care of, and we were going to move on. Right now, I'm seeing a little more fear in our citizens. What we need to be is determined at West Texas that we're going to get through this. We know there's going to be days when we get more cases, and I know there's going to be days that cases, the illness goes away for a little bit. But we have to be determined to take care of each other and do what we need to do. It's not complicated. We are deciding how it's going to affect our community. If we feel bad and we go outside, we can be spreading it. And that's what we can't do. If you feel sick, if you're a parent and one of your kids is sick, or if your spouse is sick, stay home until the illness has passed to make sure you're not spreading it. And we will be fine. But if we have people, some knuckleheads decide, I don't have to do this, I don't want to listen to this, they can cause this to spread. You may have heard on the news, there was a lot of concern with all the kids, college kids going on spring break. And all those college kids were saying, oh, we're young, we're not going to get it. And when some of the kids returned to the University of Florida, they had coronavirus. And it affected the University of Florida because these kids were exposed. So it's really up to you as a citizen. It's up to all the people around you that we've got to take care of this to make sure it doesn't spread. Some of the numbers in our surrounding cities are a little scary. Lubbock had 51 yesterday, and they were saying it was going to jump by probably 10 last night. What happened there in Lubbock is it got into nursing homes. Those people are very apt to catch the coronavirus, and it's very detrimental to those people that are that age. So that's what we don't want. People are doing a fantastic job. I see the traffic is easing up. Not near as much traffic on some of the busiest streets. That's what we want. If you go somewhere, stay 10 feet away. Stay 6 feet away from them. No gathering in groups of 10 or more. If you see a group of 10 or more and they're not 6 feet away, maybe your next door neighbor's throwing a party. Let the police know, and the police can take care of it. Because if you break this declaration, it's up to $1,000 fine and up to 180 days in jail. That's not put in there to penalize. It's put in there to make people understand how important this is. Thank you for your attention. If you have any questions, please put them on here. You can send them to me on Messenger and Facebook. I'm still learning, but I'll get to them. God bless each and every one of you. You are in my thoughts and prayers, and please be safe out there. Thank you.